Hi, everyone. Welcome back. You're still with us here on the C Morning Show. We're at the halfway point of our program, and it's time for our first discussion. But first, we have some numbers and updates to share with you as the amount of dengue cases in Depok has doubled in the past few months compared to last year, with 68 cases reported in January and then jumping to 119 in February and returning back to 68 this following month.
In comparison, in January and February of 2023, there were only 28 cases, which went down to 22 in March. One patient was confirmed dead in January while receiving treatment at Depok Central Hospital.
And this alarming spike has been blamed on weather conditions, as well as a low public awareness of hygiene and the risks that are associated with stagnant water.
Dari 3 bulan terakhir dari tahun 2023 ke 2024 ini peningkatan cukup signifikan ya, dua kali lebih banyak di tahun ini. Di Januari ada satu yang meninggal ya, yang lainnya teratasi alhamdulillah.
This 100. And we are now going to find out more in regards to this alarming trend as we are going to connect live with the Health Ministry Communication and Public Service Head, Dr. Siti Nadia Tarmizi. Good morning, Doc. Always glad to talk to you.
Hello.
Unfortunately, always under conditions such as this.
Yeah, it's an outbreak, any disease.
That's right. So let's talk a little bit about this. There was a surge earlier on at the start of this year, since January, in regard to dengue cases. What can you tell us in regards to this, the rise of these numbers in regards to the recent data?
Yeah, I think from our Ministry of Health data, our surveillance system has detect there is quite a trend increasing number of dengue cases. Because if we compare to the same weeks in 2023, which refer to the 12 weeks in 2023 and 2024, during 2023 we have found like 17,000 of dengue cases.
Wow.
While now we already got reported from provinces there is like around 38,500 cases. So if we calculate with because currently is still March, so it will be like for a quarter, so it might be we got like 106,000 cases, which means it's quite higher compared to the last year, which around 115,000.
Okay. Now, we also want to know, Doctor, what are the contributing factors of this surge?
Yeah, first, we always notice during our season transition, which means from rainy season to the hot season, or vice versa, hot season to the rainy season, we always have a potential risk to have more mosquito breeding places. We know because sometimes we got rain and sometimes it's very hot. It makes some area that potentially they can become the mosquito breeding places. And during that period, it will be more and more breeding places available at those times. So when the breeding places are increasing, so it means that the mosquito will able to reproduce more eggs and reproduce again more mosquito, while the dengue virus during the transition season, it's we know that we have a very humid weather, so it increasing the virus to be able to attack the human. So that's why with this combination, the changing of the climate, and then we know that we have like El Nino currently, and then we have prolonged hot season, and then we have situation that the community might not doing what we call it 3M. That's we try. You know that the 3M is like menguras,
Menutup.
menutup, and reduce some of our things.
Oh, okay. See, I wasn't aware of the three M's. That's new
3M.
to me as well. So, also alarmingly, there has been a rise in not only the active cases but the death toll as well, especially in Central Java. What is the evaluation from the Health Ministry in regards to this?
Yeah, we found from the numbers that in 2023, we have the same week as reported like 118 death cases. Currently, we already got reported 316 cases. So it's quite high. It's almost doubling from the last year. So the death cases usually because of low awareness for the symptoms because the patient delay they try to come to the hospital. So that's why because we know that the dengue diseases they don't have very specific clinical symptoms. Yeah, it is always come with the high fever, which sometimes in 3-4 days they not might reduce the fever, but later they have like any kind of like bleeding symptoms. For example, you have your nose bleeding, or sometimes you are coughing and there is a bleeding, or sometimes we have like we found a small note in our skin that
Red spots.
the red one, yeah, like the red spot one.
Okay.
Okay, all right. Now, Dr. Siti, earlier you have mentioned the 3M, but is there any other evaluation or any other program from the ministry that we as the society, we need to implement it?
Yeah, I think because the dengue disease need a mosquito as the factor who transmit to other humans. So it's really need to have community involvement, especially the one at the family level. Yeah, because we know we cannot monitor all the household. Yeah, whether your household have a mosquito or other breeding places for the mosquito. So it's mean that the family member should taking care their own household. So they should not have any potential breeding place, especially during this season transition. And the 3M is still the most effective, and I think that's the cheapest one intervention for dengue.
Still in our
Yeah,
control.
as long we can clean up our house, make sure
Yeah.
you don't hang your clothes everywhere. You have quite a sun light your any rooms in your house.
Okay, so you mentioned earlier as well breeding grounds for mosquitoes. I've heard of friends and friends of friends that have gotten dengue fever from exercising in the morning. They're exercising outdoors. We've been encouraged to do so, and there's larger groups. But when you go in a park, early hours of the morning or late afternoon, which is usually ideal for exercise in Jakarta, there tends to be more mosquitoes as well.
true.
Now, dengue is very unique to the fact that it's not like COVID or even the ISPA virus where it can transmit it from human to human, but it is through mosquitoes. So there are now 5 regions with the highest number of cases, which includes Jabodetabek, the central part of Jakarta as well. They have now considered this a red zone for transmission. So how do we take care of ourselves in these areas? Is there other measures? I mean, obviously, people still are going to exercise. People are still going to be outdoors. And is there a reason why the Jabodetabek areas are just red zone areas compared to other areas?
Yeah, I think why is the red zone? Because the trend of the cases are increasing. It's quite with hike. Yeah, so that's why we have a red spot. This alarm from for the government, the local government, to have quick intervention.
Okay.
So they will not have any outbreak. And the second one, Paul is right, yeah, because the Aedes aegypti, the mosquito for dengue, is usually bite us during morning or in the afternoon between 9 to 12 or 3 to 5 p.m. So it's mean that if you want to have any outside activity, it might be good you have like more lotion that have the
Yeah.
Oh, good idea.
anti-mosquito. Yeah,
Anti-mosquitoes.
yeah. And then make sure maybe if it might be good, you have like a long sleeve rather than a short sleeve.
True.
All right. And you have to make sure that you spray all the anti-mosquito spray, the one that I gave you.
Yeah, yeah.
You know, the
All natural one.
All natural
Yes.
anti-mosquito in
Yeah,
your house.
it works.
Yeah, it works for me too. Now, I also want to know, Dr. Siti, earlier this month, my son was hospitalized because he was a suspect for dengue fever, and we had to wait for 7 hours in the ER because we couldn't get the room at that time.
Full.
So it was full. Now we want to know about the hospital occupancy rate. Dr. Siti, do you think this is alarming because every hospital in the region is full?
Same with my wife. We went at 10 p.m. at night and it was already still full. Yeah,
Right?
Emergency. But...
It was alarming.
Yeah, I think the bed occupation rate currently is like 30%, but the issue for the dengue is not spreading around in all area. So we found there is the hospital quite full. It's only in certain area where the number of dengue is increasing there. But for example, if you go to the West Jakarta or in Depok, it might be they have like a quite full in the health facilities. But if you go to like the central Jakarta or you might go to the Bogor, it might be the hospital is not really full occupied. But because the spreading of the cases is not equally
even,
in
right?
every district. Yeah. So that's why we found in certain areas such as like that condition. So we ask the hospital currently if you don't have any room reform as soon as hospitals strength the patient should.
Okay, we're losing you, your connection momentarily. We're going to try to smooth it out there. I think you're back.
Okay.
Let's actually move on to our next question. We've heard that there are non-mandatory vaccinations against dengue fever. But how important do you think it is at a time like this where we know there's a transition of weather periods, there's a rise in dengue cases? How urgent would it be, in your opinion, for us to go and get a vaccination? Now, how effective is the vaccination?
Yeah, it has been a long study regarding the dengue infection. Yeah, we really happy currently we have other protection for us for dengue because since 1968 the dengue disease already been in Indonesia, but still it's like always make us a problem during this season transition. Currently, of course, this dengue vaccine not as the mandatory vaccine because the WHO has not been and they still evaluate this vaccine whether this vaccine should for mandatory or not. But any vaccine, we already noticed that it's really good to have additional protection. Especially if we are not really unsure whether our house is free of the mosquito breeding places or not. So we encourage, of course, people to get vaccination because all vaccination is good for for our protection, not only for dengue. And the effectiveness, of course, it has been have any research on that and the evaluation, and is when it's already approved by the FDA, it means the safety and then the effectiveness already meet the standard. But still, in terms of the government, we still wait for the WHO evaluation. But for individual using, if you think you need more protection, such as like influenza vaccine, sometimes people did not get it, but sometimes people will get it every year to have more protection.
Yeah, and I think it depends on a case-by-case basis. If you're in office all day, there's no mosquitoes in your house, you can probably probably do without it. But if you're constantly going outside, especially those hours, and
Active.
exposing yourself outdoors to mosquitoes, probably a good idea.
Yeah, it's a good idea. Now, speaking of innovative prevention methods for endemic dengue fever, what is the update on the implementation, Dr. Siti?
Yeah, I think we have like another intervention, yeah, what we call it the Wolbachia program that we use this Wolbachia bacteria in the Aedes mosquito because we know if the Aedes aegypti mosquito have Wolbachia in their body, so when they bite a person who have dengue diseases, they not transmit to other people or even to their eggs. So that's something that we really need to try, especially in the area where we have like high density population. And it might be difficult, yeah, to clean those areas to have free from the breeding places. So once the I think this intervention we already implement in 6 cities based on our study in Yogyakarta.
All right. Well, certainly science can certainly be a big factor to contribute the spread of this disease as well. So thank you so much,
Thank you,
Ibu
Dr.
Siti. It's always
Siti.
great chatting with you. Thank you for all the latest updates and your insights as well. And we hope that you stay healthy out there. Hope to talk to you soon.
Thank you.
Okay, thank you.
All right, that was the public service head of the Health Ministry Communication. We hope that, again, the situation is under control because a lot of the
hopefully.
symptoms, like we discussed earlier, they overlap. Like
Yeah.
my wife thought she had dengue. We went in, she got a blood test for dengue, and it turns out, no, it's not dengue, but you do have this ISPA virus, which
Yeah.
affects your sinuses. So it's the same thing. You get high fevers, you get and even a bloody nose.
Yeah,
Bloody nose is
those
alarming
ways.
because you think, oh, it's dengue, but
Yeah.
it's not. It's not necessarily dengue either. Sometimes it comes without the red spots, so it's very confusing.
Yeah, but I think it's better for you to, just prepare for the worst.
Correct. Go in and get yourself
Yeah.
tested if you have those symptoms.
That's true. All right, that's our first talk show. We are set for our break. Now, when we return, we'll bring you some updates from around the world, headlines. So keep it here on the C Morning Show.